All right. Well, good afternoon, everybody, and welcome to this week's session of the Strategic Thinker. I'm here with my awesome colleague, Dr. Jason Howell, dentist extraordinaire. How you doing, Dr. Jason?
I'm doing fantastic, Heather. It's so good to see you, and welcome to everybody who's tuning in.
Nice to see you too. Well, I'm really excited about today's topic, and I'm actually going to share my screen here because as everybody who's been tuning in regularly knows, the strategic thinker really is an extension of Spark. And what Spark is a group of small group dental practices that are focused on finding ways to continue to drive value within their dental group practices. So we do that really by focusing on our foundation, and that's something called the dental enterprise value matrix. And the value matrix is actually composed of 4 different quadrants. And what we found is that over the years of experience and insight, typically everything we talk about and everything we focus on tends to fall into one of these 4 quadrants. So cultural, financial, personnel, and process. And what Dr. Jason and I are going to talk about today, honestly, probably touches on each of the 4 quadrants. And so whenever we find something like that, that really extends into each of the areas that helps to drive value, we know that it's worth visiting about. And Dr. Jason's the perfect person to help with that today. So we're going to talk about a question that we get asked pretty regularly, and that's really how non-doctor leaders can effectively lead doctors. So one of the things that tends to happen in group dental practices is that the founding doctor, ultimately ends up producing in the beginning and bringing the group to a certain level of productivity and success, and eventually kind of migrates away from a clinical role as the group is growing. But realistically, as that process takes place, there's a whole bunch of other people along the way who end up having leadership roles, and trying to figure out, I guess, where everybody fits and how everybody can be effective is a little bit of a work in progress. So Dr. Jason, you're a doctor leader and a practicing dentist. Any initial thoughts on our topic for today?
I think it's a fantastic topic, and I will tell you, in my career, and not only within my own practices, but within practices that we've worked with, this seems to be one of the largest stumbling blocks, I would say, on transitioning as you're growing your dental group or growing your dental enterprise, is how do we effectively create leadership within our teams and allow the doctors to still be able to do what doctors do. And as you mentioned, it really comes into play when some of the lead doctors have started reaching a point where maybe they're either slowing down or transitioning out of practicing. And for a group to really continue to grow, we have to have the infrastructure of leadership among the team members to take it to the next level. And I'm excited to discuss this, and I hope it will be a great topic for a lot of those out there.
Absolutely. We oftentimes hear people say, buying dental practices or opening dental practices is easy. It's really finding the leadership, both from a non-clinical standpoint and a clinical standpoint, to keep them, running and productive and successful. That's really where the challenge lies. So I'm excited to dive a little bit deeper into this topic. So Dr. Jason and I thought it'd be helpful if we just shared our perspective of non-clinicians leading clinicians, because interestingly enough, these are our jobs on any given day. So my job as a non-dentist really is to help dentists be successful. And Dr. Jason's job as a dentist is certainly to take great care of our patients, and also to help lead other doctors to be, the best version of themselves. But also, Dr. Jason, throughout your career, you've really had a lot of experience with this non-clinical leader doctor relationship. So I'm excited to dig in.
Yeah, you're right. It's as a practicing dentist, it's always interesting for me when I am working with other dental groups is to take off that practicing dentist hat, and now I'm in somebody else's office. I'm not the practicing dentist, and to look at it from a different perspective of how, as a dentist, how can I empower the team to take the leadership and ownership so that the dentists themselves can actually do the work that we're there to do and take care of the patients. So it's very exciting.
All right, so we're going to start with bullet point number 1. And I think this might be the most important piece of our topic today, and that is just acknowledging the reality, right? So the reality is I'm not a dentist. Most likely in this lifetime, I'm not going to be a dentist. I always say in my next life, I'm going to give it a try, but probably this one, I'll just stick with what I know. And so acknowledging the fact that I'm not a dentist, and making sure that the dentists I'm leading understand that I know that and I'm comfortable with the fact that I'm not a dentist, and making sure that they understand that I'm never going to cross that line, I think is probably first and foremost job number 1 for my role. What about you, Dr. Jason?
Yeah, and for me, it's acknowledging that I am the dentist and that primarily I'm there to take care of and serve our patients. But at the same time, I have a dental team there that wants to accomplish the same thing. And they are looking to me as the dentist to be the leader in the practice. So I'll have a lot of dentists tell me as we grow our dental groups, I just want to come in and I would like to just do dentistry all day long. And that's fantastic. Most of us would. But the reminder to them is that that is part of the job, but also part of the job is you are the leader in the dental practice. And that involves more than just coming in, seeing the patients and doing the dentistry. How do we lead our teams? How do we empower our teams? How do we grow our teams? And for the teams, what I find is that they want that leadership. They want that direction. They want someone to be able to set expectations because ultimately they really want to do a great job and please or make the doctor happy with their performance. Without that expectations placed in front of them, without the conversations that we're going to have and talk about how do I become a leader in the practice, the team tends to be, they'll go in multiple directions. And then I'll see the doctors get frustrated of why is my team not doing better? And we'll have those conversations of how often have you taken time out of seeing the patients to help grow and build your team to do what you're asking them to do.
Absolutely. So the reality is we both have roles as leaders, and just depending on which chair we sit in, we have a little bit different vantage point and we have different skill sets to be able to help our teams be successful. But it's a really powerful partnership when it works well. So the next thing really is to help provide clarity to each other. So one of the things I recognized early on was that if I had a better understanding of the things that were important to the doctors I was helping to lead, that worked really well for our relationship. So getting that clarity about some of the goals you have for yourself, and some of the areas that maybe are a little bit more challenging for you as a dentist, and maybe a little bit of clarity on where you want to see yourself in the next year or 3 years, getting clarity on what you want to accomplish, but then also sharing from my point of view some of the things that I'm responsible for as a leader and some of the things I'm hoping to accomplish myself. Sometimes it's really truly just that lack of clarity and maybe a little bit of confusion as to what we're trying to accomplish that gets in the way of a really successful partnership.
That is exactly right. And for the dentist to be able to have clarity with the team leader and the other team members on what their ultimate goals are, what they want to achieve. And for me to be able to provide clarity to you, because without the lack of clarity is what tends to create the most confusion I see. And, here's the key part of it. It involves communication and conversations. And we forget that a lot of times. And it's not one conversation, it's multiple conversations, right? Mm-hmm. So this is where we get into, at least with me and my teams, or at least monthly or weekly sit downs or get togethers, or during lunch, just review things. And so I always tell everybody that the more often that we can talk and communicate, this clarity becomes, for us, it's just becomes second nature. But I see so many practices that we don't have the clarity. I don't have the clarity from the dentist of what all is going on, let's say at the front desk, or all the challenges you may have as a team leader. And then I forget to have those conversations, and the expectations that I'm putting out there aren't met. Or for the team leader to be able to provide clarity on, what are some struggles that maybe the dentist, hygienist team in the back is not doing, that's making the job for maybe the business assistants more difficult. And so we have to have the clarity, and that's what it comes right back around to the whole full circle, that we actually are all leaders within the practice, right? Each one of us is a leader, and it might have a different look and a different role, but without the leadership of each area, it just becomes, I never want to see it be 2 or 3 practices within a practice. I want it to be one cohesive team operating at such a high level that we all know what's going on. And that's clarity. It provides that.
Absolutely. And I love how you brought up communication, because doesn't that seem to be kind of the magic bullet for everything, if we just stay committed to effective communication? So once we have that clarity, I think one of the greatest things that can happen with, the practice leader and the doctor leader is that you become accountability partners really to each other. So I know over the years, sometimes this has taken on a little bit of a clinical and patient experience look and feel, but in some ways it's not at all about a clinical experience. So I know that there have been times that, doctors have said to me, hey, I'm trying to make sure that I'm really doing a good job of comprehensively looking at every patient every time. And if you see things I'm not doing, would you please point them out to me? So it might be something as simple as, if we have a patient who has missing teeth and I didn't diagnose a replacement, would you mind pointing that out to me? Well, that's really different than me saying, hey, Dr. Jason, you should have diagnosed an implant or a partial, right? That doesn't feel good. And honestly, that's not right in my book. But being an accountability partner to help you get more consistent and more comprehensive because you've asked me to, well, that looks really, really different. The other thing might be, can you hold me accountable for being, present and a good participant in the morning huddle, for instance, or something, very non-clinical, but really imperative as far as leadership goes. And the flip side is true as well. You as the doctor might come to me and say, hey, Heather, I really need you to be more consistent with making sure that our team members come on time, right? And they get their end of the day checklist done. And, that we really are committed to our monthly meeting cadence, whatever it might be. It's a two-way street, but can be a really great partnership if there's a level of accountability built in. Yeah. What do you see in this area?
You used you used a permission statement, right? And that is the key, is that to develop this accountability partner, we each have to ask to be held accountable, and we have to ask a permission statement. So I would say, Heather, would you mind, or can I get your permission that we've discussed how we want to run things? When I see something that might be lacking, do I have your permission to come to you and have a conversation that we could discuss on what we're going to do better? Or sometimes I'll say to my hygienist, Sarah, I'm going to give you permission that if you see me not treatment planning the way we have set up in our practice, how I like to treatment plan, if you see me being lazy, which is basically what it comes down to sometimes, I give you permission to ask me why I'm not doing what I've agreed that I would do. So I've put on to my team that I'm accountable for X, Y, and Z, and I give you permission that if you don't see me doing what I have promised I will do, by all means, please ask me about it. And then that way we go right back to having a conversation, developing clarity, and then holding each other accountable. And it's, again, my job, your job. Well, as leaders, we're all leaders in the practice. And now we've all taken on accountability. We have all taken on clarity, and we're all there to support each other. And this is so important because we all get tired throughout the day and throughout the weeks, and having an accountability partner. And I encourage my team, the hygienist, to have accountability partners, the front desk to have accountability partners, myself and the team leader to have it. But it all goes hand in hand as long as we're all on the same page. And that's where the clarity comes right back in.
Absolutely. So that clarity and accountability leads us really to our next little strategy, which is making sure that we've agreed to focus on the positive, but to stay committed to continuous progress. So one of the things I hear when there's a little bit of a challenge with non-clinical leadership and clinical leadership, I guess, is that it feels like they just really can't find their groove, right? It's like the only time they're really interacting is to share the things that aren't working so well. And so one of the things I think you can do early on really is within your partnership really to commit to focusing on the things that are working, because all of us there we can just naturally kind of gravitate towards the things that don't go so well. But if we really force ourselves to say focus on the positive, celebrate progress, but then, of course, just as quickly making sure that we use that confidence from doing something well to figure out what we could do even better, right? And so it's just this kind of forever real comprehensive commitment to a partnership that we celebrate together, but that we also recognize that on any given day, there's opportunity to keep doing things even better, and not just for ourselves, but for our team. And you're really good at this, Dr. Jason. I always find you just naturally drifting more towards the positive and then recognizing where we can continue to improve. So what are your thoughts on this?
It's such an important topic. In dentistry is a hard profession, and it is so easy to, I guess the easiest way, you can ask any dentist or any team member to name 2 or 3 things that didn't go so well last week, and we can name them quickly. You ask them to name 1 or 2 positive things, and we all sit and wonder, well, let me think about it. But the fact of the matter is there's so many positive things that do happen throughout the day. That we forget to acknowledge those and encourage each other. And so a long time ago, I really had to work on this. And over the years, it's gotten better and better. And one thing I do as a doctor is at the end of the day, before I leave, before everyone else leaves, is I want to make sure I take time with each individual and just simply say, hey, you did a great job today, or specifically, you did a great job with Mrs. Smith, and acknowledge them for something that did go well. Because we do in dentistry, we tend to forget all the great things we do and focus on some of the negative things. Myself and my team leader, this is where we really hold each other accountable as well, is to remind ourselves, we're kind of in the trenches together and we have a really tight relationship. And so when things don't go well, we tend to get together and really try to hash out what could be better. But we want to remind each other, you did a great job up front. Thank you so much for taking care of our team. My team leader and I tend to have someone in the morning huddle, and that's a great time that I think is pick someone randomly in the morning huddle and acknowledge them for something great that happened yesterday and start the day on a positive note. And also that gives the team member a sense of, that they get some praise, which everyone loves, but at the same time, it's in their mind, they're like, oh, I didn't even really know that anybody noticed. Sometimes it's just us thinking nobody notices the great things. And so I would encourage all the teams to start the morning huddle with one random piece of something great that happened yesterday.
Absolutely. One of the things I always appreciated, early on in my relationships with doctors is just really acknowledging those private conversations publicly. So having a team member hear me say, hey, Sarah, Dr. Jason was telling me what a fantastic job you've been doing using the caries risk assessment. Oh, wow. When Heather and Dr. Jason get together, they're not just, finding all the things we're doing not so well, but they're also really, truly acknowledging our great behavior and our commitment to exceptional care. And so one of the things that I found, again, early on was that you could really strengthen your relationship with your non-clinical leader by just having each other's backs publicly like that. Having the team, see you as a united front, especially when you're focused on the things that are really, really positive, making sure that they know that we're talking about the good things, the not so good things, and, we're going to be tackling both of those things moving forward together.
Right. Absolutely.
All right. And so that sounds really fantastic, but we all know that during the course of the day, things don't always go perfectly. And on any given day, it feels like one of us should have been doing something, maybe we weren't. And so when the sea gets a little bit bumpy and it feels like things are a little bit stressful, our last strategy really is always to refer back to number one, right? Acknowledging reality. And the reality is, I'm not the dentist, so I can't have the same experience as you have, and I can't carry the same, weight that you carry, but I can figure out how I can be a good partner to you. And on the flip side, what does this look like for you, Dr. Jason?
Well, I think as we're talking through all of these, what becomes very clear and what I've tried to do in my practices and we try to teach within our practices is that the more that we as a dentist help coach and develop the leaders within our practice, encourage them, and provide the accountability and the clarity, the more that our leaders within our practice can help basically almost balance the burdens of any other thing going on. And so what I find is that when I go into dental practices, if I see that the team leader and the doctor have a really, really good working relationship and the doctor has relinquished some of the control or leadership, basically, I'm not here to fix, manage, and control every single thing that happens with every team member. And I'm able to delegate and grow my leaders and my team. That what happens is the day-to-day running of the practice tends to be much more smooth because I don't have every team member coming to me for every single problem. They've actually stepped back and take a look at the practice as if it was their practice. They own the practice. And what would they do? I always tell them, what would you do in any of these situations with your mom, dad, sister, brother, your friend, your loved one? If they can approach these scenarios in a loving, kind way, they will actually make very, very good decisions. And I need to put my trust in those. And so the reality is that doesn't happen every day. But the real reality is if it's not happening and it's not getting to that point, most of the time I am the roadblock as the dentist. And so I would encourage a lot of the doctors out there to get with their team leaders and say, what can I do better to empower you to help grow your leadership and allow them to help grow the team as leaders? We just sometimes as doctors want to take on the ownership of every single thing that's going on in the practice. And that's not why we have our team. Our team is there to help us make the world better, make our lives better. We just have to sometimes give up that control and trust that they're going to do the right thing for the right reason at the right time.
Absolutely. Well, awesome. Thanks, Dr. Jason, for joining me today. I always think that it's unfortunate in some ways that leadership isn't a line item on a financial report or your practice management software, because I really, truly do believe the more effective you are as a leader, the more, consistent you are with your patient experiences, and ultimately, the more productive you are, and then, translate that into financial, positive financial outcomes as well. But I haven't found a report that generates leadership effectiveness. But with these tips, I can guarantee you leadership improves. So anything you want to add in closing?
No, I appreciate you taking time. It's always great to be with you. And I always learn so much when I get to talk with you. So thank you. And thank everyone for being here.
Awesome. Well, hopefully we'll see you all again in our next episode of The Strategic Thinker. And if you haven't had a chance to jump on over to sparkdentalnetwork.com, some really great resources there as well. Thanks, Dr. Jason. See everybody soon. Bye-bye.
Thank you. Bye.